your name?
Elisabeth Ozanne.
And in which city and country are you based?
I'm a professor at the Department of Social Work in the School of Health Sciences in the Faculty of Medicine at the University of Melbourne in Australia.
Great. And how would you describe what you do to a layperson?
Very difficult. Well, I'm an academic. I'm responsible for training social work students, and my major areas of research are in social gerontology and organisational administration. And at this conference is really social policy in relation to an older population. And I have published a book with colleagues on longevity and social change in Australia, which was an overview under the last government of the current state of policy development for the aged in Australia.
Interesting. What is commonly understood as long-term care in Australia?
We don't actually use the term long-term care, and in Australia you would more appropriately talk about aged care.
Okay.
And also disability services have been previously largely state provision, and they are considered a separate area. So in Europe and America and UK, they are considered part of long-term care. In Australia, we tend to differentiate and we call them aged services and disability services. So long-term care would not be a familiar term to the lay public in Australia. It would be to public policy people and to bureaucrats, etc.
Okay. And what's generally included in aged care in terms of services?
Home and community care provision and residential care provision.
Okay.
But there are a number of other aspects relating to the social inclusion and participation of older people in society. We have an age discrimination commissioner appointed last year to advocate for the rights of older people and to look at mature age employment. So a lot of other departments are becoming more aware of the implications of population ageing and the need to make sure discrimination is not sort of in evidence in their particular area of practice.
Okay. What would you say are the three main policy priorities for aged care and disability in Australia at the moment?
Well, as I've just been talking about, the government feels there is a priority to upgrade the capacity of the system to deal with the rising demands of an ageing population,
Okay.
the related health costs, and what are the social implications for the way people wish to live as they age, and of course how this is going to be financed. We have a major health reform going on at the same time as we've got this current implementation of a new aged policy agenda and the current implementation of a new disability agenda. And all of those are interlinked, although not integrated. So, what was the question again?
The main three policy priorities.
In ageing, I guess, how is the system going to be financed going forward? Where is the workforce going to come from? And can we make some efficiency gains in our shift to more enablement restorative care programs so that fewer people need long-term care?
Okay. And how have these priorities changed over the last 5 to 10 years?
I think they have changed a lot, even reflecting on this conference, to the conference 2 years ago. We've moved on enormously in terms of a system perspective and looking comparatively in Australia, even though we're a long way from here, very much looks to what the UK, the US, and now increasingly what's happening in Europe in terms of options for policy development and different ways of resolving the financing problems, whether they be market mechanisms or alternate mechanisms. So the ability to sort of share that information. There's a lot of convergence, I think, going on in different regions of the world, perhaps promoted by the OECD, who's taken the lead in their major report on sort of health wanted and giving a sort of international overview of long-term care policy, at least for OECD countries. But having this sort of conference where you've got so many research groups, including 6 to 8 countries reporting, is very important, I think.
Definitely. Where do you see aged care going, or the policies around aged care going in the next 10 years or so?
Well, in Australia it is going to depend whether we continue with our social democratic Labor government or if we have a change to Liberal government, because ideologically they will go in different directions. I think the Liberal government will be much more market oriented. They will be decentralising, whereas the Labor government will moderate market impacts, do tend to be sort of centralising in their policies. So I think that's perhaps the major uncertainty, apart from the broader economic environment, that with the ageing of the population, it's becoming more difficult for all countries to finance long-term care into the future. So where is the money going to come from? We need to educate the population about their responsibility to pay for a certain proportion of their care, but I'm not sure they're actually aware of that at this point in time.
Interesting. Interesting. Do you get a sense that the financial crisis has had an impact on aged care?
Much less in Australia, I think, than it has had in Europe. I mean, we only have 5% unemployment, which is very different to Europe. Our budgetary situation has been quite good, although the current government has been implementing several major reform agendas currently, which make it a challenge going forward to maintain a surplus, which they promised they will do. So, and also I think there's a concern that ageing issues might get crowded out by health, education, border protection, introducing carbon taxes. These have been the big issues of the first term of our Labor government, and ageing only got up because people were concerned that it wasn't in the first term.
Okay.
So it easily could be crowded out.
Okay. And if you had the opportunity to introduce one new policy reform around aged care, what would it be and why?
In Australia, the role of the Productivity Commission is to systematically review areas for development, and I think their report of care of older Australians has laid out a very good agenda for change and the options the government of the right or the left may take. So it's a very up-to-date review. It's used the last census data. It's the most thorough analysis that we've had for perhaps the last 15 years. And I think it gives a ready framework. It's the political and the financial decisions that surround what can actually be implemented. We are on a trajectory of increasing community care, of improving people's general health and well-being so that they maintain themselves independently in the community. There are issues, I think, about how people are going to pay for long-term residential care if they do live a lot longer, and that is both a government and an individual issue. But again, education of the population, and again, training up and building the capacity of a workforce to work in a more personalised, individualised, enablement, restorative way is a challenge. And the integration across all our different systems, they still operate fairly independently in Australia. That service integration is an idea that's not yet been operationalised.
Okay.
A lot of rhetoric, but delivery is not see.
Okay. And in your view, what's the one piece of policy or research evidence that's still missing that could influence or inform aged care policy in Australia?
I actually think always when I come to LSE, one appreciates the critical policy thinking that has gone on over a long period of time of the relationship between social and health issues. I think in Australia we don't have any one centre that has that tradition or does quite that level of thinking. I think the Productivity Commission has provided an agenda, but thinking through different policy options and looking at some of the political and financial decisions that have to be made, I think we need academics to become more informed and interested in this area, and the need to participate internationally in terms of a comparative dialogue is more and more critical.
Okay. Interesting.
Mm-hmm.
I'm going to ask you 5 quick-fire questions.
Right.
And on a scale from 1 to 10, could you rate what policy priority is allocated to long-term care or aged care in Australia?
Well, as I said before, I think amongst the general population and even in terms of government preoccupation, there have been other priorities, and this was illustrated in the first term of a new government that was on about health, was on about border protection, was on about education. In fact, in our first Labor government, nothing was said about ageing. And that was a real contrast to the previous Liberal government, who had, over quite a long period of time, developed a sort of substantial package of services and approaches. So it goes back to that crowding out problem. However, the population is ageing. I think various advocacy groups are now getting more organised in presenting their claims on the public purse and to government, and also the trend in government to a more participatory democracy where they do actually consult directly with various user groups, articulates that demand in a fairly systematic way. So because the population is ageing, I think that demand will drive the change, but you'd have to say that other priorities can easily crowd out ageing.
Okay. And if you had to give it a scale rating between 1 and 10, 1 being low and 10 being high, what number would you afford the policy priority?
Personally, high.
High.
Because I in my own university, I'm continually trying to impress upon our hierarchy the implications right across the board of population ageing for urban design in architecture, for new technologies with the rollout of broadband, for new fiscal design packages we need in terms of income security in later life, and various models of social insurance about which we've heard a lot at this conference. But I still think major institutions, particularly in Australia, which has been a young country, are lagging in recognising how critical ageing is and how it is going to impact on all aspects of life.
Okay. And sort of between 1 and 10, how aware do you think the general public is about what the aged care system offers them in Australia?
I think not very aware, and most of the studies show that people don't plan ahead very well and that we do need to improve our level of education about expectancies of ending up needing long-term care or financially planning for a longer life. There is a big education issue, and I think the general public, although there's more general discourse in the media about ageing, there is still a long way to go, I think.
Okay.
And in particular Australia, because we think about ourselves as a young country, you know, we're all sport and beach and youth is the image of Australia. Whereas I think if you come to the UK, you get a more moderated sort of life course picture.
Okay. Interesting. Yeah. How well do you think the aged care system supports people with long-term care needs?
Well, I think we're beginning to articulate what those needs are amongst informed academics and service providers. The issue will be what people will be able to get access to in the future, and how will it be paid for? What will they pay themselves? What should the government provide? And what's the sort of relative rights and responsibilities in relation to that?
Okay. And how well do you think the system supports carers?
In Australia, I think it's been quite strong that since the mid-80s, carers have been recognised as co-providers and co-clients. We've had carer payments and carer allowances, even though tokenistic. There has been recognition, and several previous governments have set up an infrastructure to support carers, and there are active advocacy groups for carers around the country for both the aged and the disabled and the younger people with disabilities. So I think Australia has done well in that area.
Okay.
However, you know, with severe illness, as in some cases of disability, there does need to be more financial support, and I think that's why we've just introduced disability insurance.
Okay. And how integrated do you think the health and social care systems are in Australia?
As I said before, I think there's a lot of rhetoric about it,
Mm-hmm.
but I don't think they're very integrated at all at this point in time.
Okay.
And there are a lot of programs and projects on the ground and sort of research and development exercises looking at better achieving integration, but we've got a long way to go.
Okay. Thanks very much, Elisabeth.
Okay.